Erectile dysfunction is a condition where the patient or their partner are unable to achieve adequate erection or a satisfactory sexual intercourse. Erectile dysfunction is a very common condition, with approximately 50% of patients by the age of 50 experiencing symptoms from this. Erectile dysfunction can be caused by a variety of issues. Often they're related to vascular disorders that lead to poor blood flow or conditions such as diabetes. Erectile dysfunction can be diagnosed in multiple ways. Sometimes the patient may present with clinical symptoms that are hindering their sexual performance. Other times, we may utilize imaging modalities such as an ultrasound to diagnose the cause of erectile dysfunction. Erectile dysfunction can be prevented with a good diet and routine exercise. However, other predisposing factors and comorbidities can lead to erectile dysfunction. The care for erectile dysfunction can be very nuanced, and it's important that your providers are well aware of all the options that are available for you. There are multiple options for treatment of erectile dysfunction. To begin, there are oral options such as Viagra, Cialis, Levitra, which may work for some patients. However, if those fail, then injectable therapy is also an option. Some patients may not prefer having to inject themselves prior to intercourse. In those cases, a pump may be utilized. And lastly, if all those options have failed, then an inflatable penile prosthesis or a malleable penile prosthesis might be the option for you. Different treatments may be best suited for different patients, and at the end of the day, our objective is to find the correct treatment for each individual. Oral options may work great for some, but not others. Injectable options may be available for those patients. However, ultrasound and other imaging modalities may give us a better insight into what may work best for patients. And if that is the case and a prosthesis works best, then we will recommend that. Patients have an amazing satisfaction rate after undergoing penile prosthetic surgery, with some surgeries reporting over 90% satisfaction rate. The partner satisfaction rate can even be higher based on certain studies. There are multiple long-term consequences of erectile dysfunction. First and foremost, this may be a sign that there may be something else going on. For example, cardiovascular related issues, and it's important to see your primary care provider for that. In addition, this can lead to a deterioration in relationships and overall mental well-being. Issues related to self-esteem with erectile dysfunction are commonly cited as well. Lastly, untreated erectile dysfunction can lead to loss of penile length, which has been reported in various studies.